Hello students, we will discuss today another swelling which is common in females. Look at this and identify what this swelling is. Very typical it is. So what this condition or this swelling or this condition is, look at this one over the waist here, common in females. You can see the bangle here, sari you can see. So naturally this patient is female. So this swelling, you can see that what are the few possibilities in this patient or possible diagnosis. Look at this and have a look. So this is calcinosis cutis, very common in females, especially those who are wearing sari and those who hold water in a bucket or something in the Indian subcontinent and keep here, and then they'll get, because of friction, many times both sides it happens, and it gets fixed, it get calcified as a dystrophic calcification, very typical calcinosis cutis. Now, what are the differential diagnoses? You can think of calcified sebaceous cyst, you can think of rare calcified bursa, you can think of secondaries. But once you examine the patient, mostly it is a very typical cutaneous swelling extended to the subcutaneous plane, but freely mobile, but very hard, often tender. That is very typical, many times bilateral. In the typical in this region it occurs. That is calcinosis cutis. But it's the differential diagnosis which you have to think of. It's a dystrophic calcification occurring in the skin, common in the female, common in the waist region, commonly bilateral to friction and subcutaneous tissue with the calcification. These are the different features. Now treatment is under local anesthesia, excise it. If I got some doubt, we can do needle aspiration, confirm it is not malignancy. It's unlikely to be. Treatment is laxation and suture it. They often sometimes require, because skin has to be excised, requires a local rhomboid flap or Z-plasty or some local rotation flaps are required to oppose the skin, not a difficult thing. And with many times bilateral you can do both sides together. So that is calcinosis cutis, not uncommon, especially in Indian subcontinent. Treated with excision with the awful rotation flap. You can always see the photos of this condition and how to examine swelling. You can go through my SRB clinical methods in surgery, current edition with the proper video of examination. My SRB manual of surgery for a detailed explanation of all these swelling conditions, surgical operation, how to excise a swelling, step-by-step operative procedure, of course tissue approximation, suturing. My digital lectures, you can go through that, through JP publishers, everything surgery as far as CBM syllabus is there, A to Z, with the operations, basic surgical operation, clinical examination, then urology, neurosurgery, cardiothoracic surgery, very useful. You can always subscribe for a year. So students, I hope you understood this condition very clearly. Thank you very much.